So we come to that place where we begin to notice and to realize that we must do enough, do a lot, and do everything in our capacity and in our power to be able to make sure that people can be able to live their lives and strive to be who they are. If all we do most of the times in our lives is stifle the desires and the will of the people to do what they want to do, and then we create a situation and a scenario where things go out of hand. When things go out of hand, we can't bring them back. And if we can't bring them back, we must look for those to blame. And because we are going to want to blame people, it gets messy, unacceptable. And when things get to that stage, we begin to notice that the blame games, the pointing of fingers, the desire to want to be in control, are pushed to the fore. And all of that is unacceptable. It's unnecessary. Why? Because we don't know how to do what is expected of us. When we don't know how to do what is expected of us, anything goes. And in situations where things just happen, we would sit back and think that it's we. Because that's the human tendency. That's the human desire most times and wish. But most of what we wish and desire may not always happen the way we want them to be. So I believe, and it's my utmost hope and desire, that one day we will be able to sit together and have a solution, try to talk things over, and get people to understand and to know that there is a solution, there is a hope. Because when we talk about global health and we look at global health definition and global health interventions and the things which are done in global health, we must have been able to choose where we want to focus our attention and strategically direct the resources that we have with particular and specific goals in mind. When we do that, we will engage and be involved in activities which will work towards the realization of those goals. Because to me, success is the mobilization of resources towards goals, realization, and achievement. So if you set out to do great things and you want to succeed, you must be able to set your goals. Because when your goals are set, you are somewhere and somehow towards realizing them. But if you have no goals set, there is no way that you can successfully engage and realize any venture. We live in a world and at a time when people are constantly looking at things, looking at others, wanting to tell themselves, is this going to work? Is there a framework that we can work it? And in the most part, I think that there are frameworks under which certain things can be done. Let us not misunderstand and misinterpret what we are saying and what we are doing. There is always hope, I believe. There's always a way if we are determined, we want to make a difference. We'll always find something and some way to do it. And if we have no interest to do anything, we will reluctantly follow the wishes and ideals of other people that will get us to nowhere. So the pillars of global health systems, we have the financial pillars, the infrastructure, the informatics, service delivery, human resources, leadership and governance. So, leadership and governance of health systems is very, very important for health systems to succeed. Because most of the times when we talk about leadership and governance, we are talking about governing boards. We are talking about decision making. As it relates to organizational objectives and purposes, and we see that the leadership and the governance component of it works with the other pillars to realize the ultimate health needs and goals of any health system. So, good governance, good leadership will execute, will strategize, will mobilize resources, be they human, material, health commodities, financial resources, whether they are through insurance, out-of-pocket payments, governmental resources in different programs like we have Medicare and Medicaid, Medicare for the seniors, Medicaid for the indigent, those who have financial difficulties, are all very, very useful. Where those systems are properly elaborated and put in place, we have no doubt that the expected results will be realized. So it's incumbent on those who are called to do the work to engage all stakeholders, mobilize the interest. The stakeholders most times are within communities. So we talk about community engagement and mobilization. And when the stakeholders from the communities are brought on the table, then we can communicate risk, to the people that represent through those channels. I have no doubt that that is the framework and the model for the 21st century. And that model will serve us real good and greatly, because I believe that we are going to apply the model and we will do it in a very purposeful manner. Notwithstanding the challenges which will be in place, let's be rest assured that our efforts will not go in vain, because our determination and resolution is sure and strong. I have no fear that the days ahead are going to be very fruitful days, sure, straight, and steady. We are walking, we are making progress, and walking towards the realization of our goals. So, I will continue to believe that health systems play a major role in healthcare of any nation. As I said, the health commodities, be it therapeutics, vaccines, and others, health commodities and products must be mobilized. Health system leadership and governance must be useful and applied. Service delivery and quality. Very, very important. Human resources, capacity, whether it's formation, recruiting, staff, personnel, the quality that we get and we put in place, the training, and all of those are very, very important for any successful health system and realizable and successful outcomes to be achieved. Finances. In a mixed system that like the United States, we have private sector and government financial contributions in procuring health care. In the United States, we have the private insurers who mostly insure people who buy insurance personally and or through their employers. There is the different levels for the employer system. There are also co-pays here and there. There is the government provided insurance for the seniors and elderly, what we call Medicare. And Medicare is into a number of parts. Medicare Part A, you hear Part D and the others, and there are things which go with them, which means that the Medicare for drugs, provision, hospitalization, emergency care, doctor visitation, and everything. What is covered by Medicare varies depending on the type of Medicare that the seniors have. There are also some amounts of copay with Medicare. There are some things which are not covered by Medicare. Medicaid is for the indigent or the poor, financially hard up people. Again, there are different things which are covered, and there are different categories of people who are involved, and what they can get. You know, they started off with what they call Blue Shield. We had the Blue and the Shield, and then the Blue Shield, and all of that. There is a history behind all of those. Then there is the VA, which is the healthcare provision through the government, insurance provision for veterans and their families, people in the military, the VA system. That also takes a big chunk of the healthcare dollars or money in the United States. So the American system, as I said, is a mixed system of the private and the public contributing towards healthcare provision and delivery. Access, affordability, cost, availability are very, very important, including quality. All of those work towards great outcomes. And there are mechanisms that are in place for the realizations for the realization of those. The community health model has been promoted by lots of people. But when we talk about healthcare infrastructure, the healthcare infrastructure also, like healthcare finance, is done in a mixed fashion. There are healthcare infrastructures that are provided by private people, non-profit, healthcare infrastructure, hospitals, community health centers. There are also those which are provided by governments at the local level. At the central level, we have the VA clinics or hospitals which cater for the needs of veterans and their families and related people. We also have the non-profit religious hospitals, and then we also have private for-profit hospitals. We have health commodities that are provided by these hospitals. In the case of the United States, we have private companies that provide health commodities, sell them like drugs and over-the-counter therapeutics, and Walgreens, Walmart, CVS, and there are pharmaceutical clinics. So, in a nutshell, that is the healthcare system in the United States, the principles and management, leadership.